Hi, I'm Jennifer, and I'm one of the patient coordinators here at Aguiar Plastic Surgery in Tampa, Florida. I wanted to take a moment and talk to you about a recent patient that we had and her successful surgery. She was a young, athletic 19-year-old girl from South Tampa, Florida, and she was going to be home for the summer in between her freshman and sophomore year of college and wanted to have a breast augmentation. She was always an A cup. She said that none of the women in her family had good breasts, that they were all very small-breasted women, and that they had larger hips, and she wanted her breast and her hips to be more proportionate. So she said she'd like to be a C cup. She said it was really important to her because she wanted to be able to better fill out her clothing. For her surgery, Dr. Aguiar recommended a transaxillary approach for her surgery. This is the approach where Dr. Aguiar uses his scope and goes through the armpit and makes his pocket from that approach and inserts the implant from the armpit. It's called transaxillary approach. He often recommends this to young women because it leaves no scar on their breasts. And since she was 19 years old and has many years ahead of her, he thought it would be best to have no scar on her breast. So he was able to successfully do her surgery. He used a Natrelle Style 68 Moderate Plus Profile 300 cc implant, and he filled that to 320 cc's of volume on both breasts. You can see in the pictures that the scar is well hidden in the armpit and that eventually it will fade away to a thin white line in the natural crease of her armpit. She was an excellent candidate for surgery and achieved the results that she wanted and was very excited to return to college. She said many of her friends were having breast augmentations over the summer that year also. It's such a joy when we can help a young person feel comfortable about herself and be successful in her life.